the major to the discussion of one simple example I want to tell you. Whenever the government gives an order, if they give an order, X, Y, Z should be implemented. We are concerned about how best this particular order is implemented up to the citizens level. That is our calculation. I mean to say that as per the government system, we know that in BBMP, chief commissioner is there, zonal commissioner is there, joint commissioner is there, then nodal officer is there, then ward committee members is there, and different RWs are there, area sabhas are there. So where even though government is sanctioning lot of funds, even though government is putting lot of plans to control, particularly we are discussing today in the meeting how best we can control this pandemic. ಕೊರೋನಾವನ್ನು ನಾವು ಹೆಂಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡಬಹುದು. ಸರ್ಕಾರ ಎಲ್ಲ ತರದಿಂದ ಸಹಾಯ ಮಾಡ್ತಾ ಇದೆ, ಅದು ಫಂಡ್ಗಳು ಕೊಡ್ತಾ ಇದೆ, ಆರ್ಡರ್ಗಳು ಕೊಡ್ತಾ ಇದೆ. ಯಾಕೆ ನಮಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡ್ತಾ ಇಲ್ಲ? ನಾವು ಎಲ್ಲಿ ತಪ್ಪು ಮಾಡ್ತಾ ಇದ್ದೀವಿ? ನಮಗೆ ಕರೆಕ್ಷನ್ ಮಾಡ್ಕೊಳ್ಬೋದಾ? ಯಾವ ರೀತಿಯಿಂದ ನಾವು ಈ ಕೊರೋನಾವನ್ನು ಕಂಟ್ರೋಲ್ ಮಾಡಿ ಆದಷ್ಟು ಬೇಗನೆ ಜನರ ಪರಿಸ್ಥಿತಿಯನ್ನು ನಾರ್ಮಲ್ ಲೆವೆಲ್ಗೆ ತರಬಹುದು? ಅದೇ ನಮ್ಮಲ್ಲಿ ದೊಡ್ಡವಾದ ಪ್ರಶ್ನೆ ಆಗಿದೆ. ಈ ಡಿಸ್ಕಷನ್ ಅಲ್ಲಿ ನಾವು ಪರ್ಟಿಕ್ಯುಲರ್ ಆಗಿ ಕೊರೋನಾ ಸಿಸ್ಟಮ್ ಅನ್ನ, ಇದು ಸೆಂಟ್ರಲೈಸ್ ಸಿಸ್ಟಮ್ ಏನ್, ಕಾಂಟ್ ವಿ ಡೂ ಡಿಸೆಂಟ್ರಲೈಸ್ ಇಟ್? ಈಗ ಮೇಲಿಂದ ಆರ್ಡರ್ ಕೊಟ್ಟ ಮೇಲೆ ಝೋನಲ್ ಕಮಿಷನರ್ ಬರುತ್ತೆ, ಜೆಸಿಗೆ ಬರುತ್ತೆ, ಆಮೇಲೆ ಏರಿಯಾ ಸಭಾಗ್ ಬರುತ್ತೆ, ಆಮೇಲೆ ಇಟ್ ವಿಲ್ ಕಮ್ ಟು ward committee members also. Empowerment, why we are not given to the downtown up to lower category of people? Why this is happening? What I want to tell you, the particular point is, whenever you tell don't use mask, okay, they will declare an order and everybody will say video is see and televisions will come. How it will be effective provided your community leader comes and conduct this activity? Lot of difference is there. ಯಾವಾಗ ಅವನು ಒಂದು ಏರಿಯಾದಲ್ಲಿರ್ತಕ್ಕಂಥ ಲೀಡರ್ ಆದವನು ಹೋಗಿ ತನ್ನ 10 ಜನರಿಗೂ ತನ್ನ 50 ಜನರಿಗೂ, ನೋಡ್ರಪ್ಪ ನೀವು ಮಾಸ್ಕ್ ಅನ್ನು ಹಾಕಿಸಿ, ಹೊರಗಡೆ ಹೋಗಬೇಡಿ, ಆಮೇಲೆ ಎಲ್ಲರೂ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತೆಗೆದುಕೊಳ್ಳಿ, ಈ ತರದ ಮೂವ್ಮೆಂಟ್ ಮಾಡೋದ್ರಿಂದ ಯಾವುದೇ ಕಾಯ್ದೆ ಕಾನೂನುಗಳನ್ನು ಮೇಲಿಂದ ಕೆಳಗೆ ವರ್ಗೀಕರಿಸಿದಾಗ ಅದು ಎಫೆಕ್ಟಿವ್ ಆಗಿರುತ್ತೆ. ಅಂದ್ರೇನು? ಡಿಸೆಂಟ್ರಲೈಸೇಷನ್ ಮಾಡಬಹುದಾ? ಒಂದು. ಎರಡನೇದು, ಆರ್ ದ BBMP have got right to control and have a right over controlling the pandemic situation? ಇದು ಮಾಡಬಹುದಾ? ಪೆಂಡಮಿಕ್ ಮಾಡ್ಲಿಕ್ಕೆ, ಕಂಟ್ರೋಲ್ ಮಾಡ್ಲಿಕ್ಕೆ ಇವರಲ್ಲಿ ಒಂದು ಸರ್ಕಾರ ಹೇಳಿದ್ರು ಕೂಡ ಅವ್ರು ಮಾಡಿದ್ರು ಯಾಕೆ ಕಂಟ್ರೋಲ್ ಆಗ್ತಾ ಇಲ್ಲ? ವೈ ವಿ ಆರ್ ನಾಟ್ ಅನ್ಏಬಲ್ ಟು ಕಂಟ್ರೋಲ್ ಸ್ಟಿಲ್? ಅಂಡ್ ಇವನ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಡ್ರೈವ್ಸ್ ಆರ್ ಟೇಕಿಂಗ್ ಪ್ಲೇಸ್, ನೋ ಡೌಟ್, ಅಂಡ್ above 18 also they have declared that vaccination has to take place. Are we planning to reach up to the area sabha level? That is my question. ಆಮೇಲೆ ಯಾವುದೇ ಆರ್ಡರ್ಗಳನ್ನ, whenever we give an order, a commissioner gives order, chief minister gives order, it will go to the up to area sabha. Are we checking back? ಏರಿಯಾ ಸಭಾದವರು ನಾನು ಮಾಡಿದ್ದೀನಪ್ಪ ಅಂತ ವಾರ್ಡ್ ಕಮಿಟಿ ಮೆಂಬರ್ ಹೇಳಬೇಕು, ವಾರ್ಡ್ ಕಮಿಟಿ ಅವ್ರು ಮಾಡಿದ್ದೀನಿ ಅಂತ ನೋಡಲ್ ಆಫೀಸರ್ ಹೇಳಬೇಕು, ನೋಡಲ್ ಆಫೀಸರ್ ಮಾಡಿದೆ ಅಂತ. ಈ ತರ ನಾವು ಹಿಂದಿಂದ ಕೂಡ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಬೇಕು. ಅವಾಗ ಮಾಡಿದಾಗ ಏನಾಗುತ್ತೆ, ಒಂದು ಆರ್ಡರ್ ಕೊಟ್ಟಾಗ ನನ್ನ ಪರ್ಸೆಂಟೇಜ್ ಆಫ್ ಇಂಪ್ಲಿಮೆಂಟೇಷನ್ ಎಷ್ಟಾಗಿದೆ, ನಾವು ಎಲ್ಲಿ ಯಾವ ಸ್ಥಳದಲ್ಲಿ ನಾವು ಸರಿಯಾಗಿ ಇಂಪ್ಲಿಮೆಂಟೇಷನ್, ವಿಚ್ ಆರ್ ದ ಪ್ಲೇಸಸ್ ವಿ ಆರ್ ನಾಟ್ ಸಕ್ಸಸ್ಫುಲ್ ಇಂಪ್ಲಿಮೆಂಟಿಂಗ್ ಅ ಪರ್ಟಿಕ್ಯುಲರ್ ಥಿಂಗ್. Why I am telling all those things? This is the one of the example that in correcting our system, particularly decentralizing and empowering the particular even area sabhas and ward committee members, by practicing it, making system correctly, breaking the chain, this particular system will definitely help us for future action. Of course, ನಮ್ಗೆ ಗೊತ್ತಿಲ್ಲ, we don't know ಇದು ಇಲ್ಲಿಗೆ ಮುಗಿಯತ್ತಾ, ಏನು ಮುಂದೆ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಥರ್ಡ್ ವೇ ಬರುತ್ತಾ? ಅದಕ್ಕಾದ್ರೂ ನಾವು ಒಂದು ಥರದಿಂದ ರೆಡಿ ಆಗಬೇಕು. ನಾವು ಏನು ಮಾಡ್ಬೇಕಂತ ಪ್ರತಿಯೊಬ್ಬರೂ ಡಿಸ್ಕಷನ್ ಮಾಡಬೇಕು. ಆಮೇಲೆ ಇವನ್ ವಾರ್ಡ್ ಕಮಿಟಿ ಕೂಡ ನಾವು ನಮ್ಮ ರೆಪ್ರೆಸೆಂಟೇಷನ್ ಕಳಿಸಿದ್ದೀವಿ. ದೇರ್ ಇಸ್ ನೋ ಕ್ಲೋಸ್ ರೂಮ್ ಮೀಟಿಂಗ್ಸ್ ಆಫ್ ವಾರ್ಡ್ ಕಮಿಟೀಸ್. ಯಾವಾಗಲೂ ಇದನ್ನ ಏನೋ ವರ್ಚುವಲ್ ಮೀಟಿಂಗ್ಸ್ ಮಾಡ್ರಿ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀವಿ. ಇವು ಬೇರೆ ಒಂದು ಚೇಂಜ್ಗಳನ್ನು ತಂದು ನಮ್ಮ ಪೌರಾಡಳಿತವನ್ನು ಹೆಂಗೆ ಗಟ್ಟಿ ಮಾಡಬಹುದು, ನಮ್ಮ ಪೌರಾಡಳಿತವನ್ನು ಹೆಂಗೆ ಎಫೆಕ್ಟಿವ್ ಮಾಡಬಹುದು, ಇದೇ ನಮ್ಮ ಧೋರಣೆ ಆಗಿದೆ. ನಾವು ಮುಂದಿನ ಬರೋ ಯಾವುದೇ ಕಷ್ಟ ದುಃಖಗಳಿರಲಿ, ವಾಟ್ ಎವರ್ ದ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗೋಯಿಂಗ್ ಟು ಫೇಸ್ ಇನ್ ಫ್ಯೂಚರ್, ಐ ಆಮ್ ನಾಟ್ ಟಾಕಿಂಗ್ ಓನ್ಲಿ ಇನ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್, ಇಟ್ ಮೇ ಬಿ ಎ ಡಿಫರೆಂಟ್ ಸಿವಿಕ್ ಇಶ್ಯೂಸ್ ಲೈಕ್ road or sanitation or water, airborne disease, waterborne disease, ಸಾಕಷ್ಟು ನಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಬರ್ಬೋದು. ಒಂದು ಸಾಂಕ್ರಾಮಿಕ ರೋಗವನ್ನು ನಾವು ಎದುರಿಸಲಿಕ್ಕೆ ನಾವೆಲ್ಲ ಜನರು ಎಷ್ಟು ಕಷ್ಟಪಡ್ತಾ ಇದ್ದೀವಿ. ಈಗ ನಾವೆಲ್ಲ ವಿದ್ಯಾಭ್ಯಾಸ ಮಾಡಿದವರೇ ಇಷ್ಟು, ಈಗ ತಪ್ಪು ಎಲ್ಲಿದೆ? ಈಗ ಗೌರ್ಮೆಂಟ್ ಹೇಳಿದ್ರು ಕೂಡ ಯಾಕೆ ಜಾಸ್ತಿ ಆಗಿದೆ? ತಪ್ಪು ನಮ್ಮಲ್ಲೂ ಇದೆ, ನಾವು ಅದನ್ನು ಒಪ್ಕೊಳ್ಬೇಕು. ನಾವು ಹೇಳಿದ್ದು ಫಾಲೋ ಅಪ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಇಲ್ವೋ, ಮಾಸ್ಕ್ಗಳು ಹಾಕೊಳ್ತಾ ಇದ್ದೀವಿ ಇಲ್ಲೋ, ಸ್ಯಾನಿಟೈಸೇಷನ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಇಲ್ಲೋ, ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಳ್ತಾ ಇದ್ದೀವಿ ಇಲ್ಲೋ. We have to correct ourselves first in the base. We cannot comment even either the government or officials also. That is also one of the part and parcel of a discussion. How best the different RWAs can take up the issue and do the further things. This is my first thing, and I'll ask Jairaj sir to clarify certain points regarding further discussion, and in between also I'll join.
Thank you, Mr. Srikanth Ramakant.
Yes, sir.
Hello, Srikanth. Hello, all
Yes.
Participants. I had told Srikanth that, let us make this a purposeful question and answer session so that we can really bounce ideas and try to develop them. And let us not convert it into monologues. I certainly don't want to make it into a monologue or a moral instruction. But I want to, put some issues before you from what Ramakant ji has said. I was in a session earlier today and they asked a question there as to, how do we bring Bangalore back to its preeminent position? Assuming that such a position existed earlier, what is the meaning of preeminence? And I said that, and I would like to pose this before BNP, that the key to preeminence is that, there should be institutional resilience. The civic institutions that are working in Bangalore must be resilient bodies. And I think that is what really BNP is trying to do. Of course, what it means by resilience, how we can do it is another issue. But the strength of institutions is very important. The second is, we require financial resources. The only thing that Bangalore City Corporation has presently, which is elastic, is property taxes. But that will not do. We require other mode of revenue also. The thirdly is execution of works, project management ability in Bangalore City, in all the civic bodies, especially the BBMP. And fourthly, we require good partnership with all stakeholders, the public, so that people know and realize that they are in charge and they can do it. And that also means ward level participation, ward level involvement. Now, it's only when you put all these four facts together, four issues together, that you can have a Bangalore of your choice. Someone asked me, what do you think of this new act? I said this new act is only a de jure act. It is something on paper. De facto, Bangalore Mahanagar Palike, athwa all the other civic bodies, they are highly inefficient, they lack capacity, they do not have administrative wherewithal, and they're involved in huge conflict within and without. So until you set it right, you're not going to get a resilient organization. So I want to begin with these words because as I said, I see there are 159 participants and everybody's voice must be heard. So I have made this preliminary remarks basing myself on what Ramakant ji has said. We can speak about COVID, we can speak about wards also. Now over to Srikanth, over to Soumya, over to BNP so that you can also join in and you can, get this conversation going. Thank you. Srikanth?
Yeah. Thanks a lot, Mr. Jairaj. First of all, thanks for joining. We truly appreciate. We are looking at a lot of guidance from people who've been involved in administration in running Bengaluru a lot better. Not just the COVID management, but the larger set of issues. But I think COVID is probably a test case of what is it that we can do differently. So the first question that I have is, BNP's firm belief is that decentralization is going to be very critical, whether it is managing COVID or resolving any other issues. The involvement of citizens involvement of resident welfare associations, apartment associations, having properly functioning area sabhas, ward committees. We would like to hear your views on the importance of the bodies like these, citizens, RWAs, area sabhas, ward committees, in working along with the administration. And if these had been properly constituted, would we have been in a position to better manage this COVID crisis and any other issues that might come up in the future? That's one fundamental question that I think not just me, all of us here would like to ask. After that, we'll keep going to others for specific questions.
I'll put this back towards you, Srikanth. Srikanth, what do you think? What do you think went wrong with COVID management in Bangalore?
We firmly believe that the first is, of course, I don't think the government anticipated the second wave. I don't think we were prepared in the first place.
Yeah.
So I think we became complacent, and I think it's not just the government. I think we the citizens. I firmly believe when there is a problem, you can't just pinpoint the blame on one single side and say that this is responsible. And I made this point right in my opening remarks as well. Blaming the government and pointing the finger at the government is probably the easiest thing to do. But the government went wrong in definitely not anticipating or preparing. And I think we, the citizens, are also equally responsible, because even when we realized that the second wave was happening, I don't think we, the citizens, took a lot of precautions, etc. So there has been this curious combination of citizens being lax on the one hand, and on the other hand, the government not being prepared with adequate infrastructure. I think that's where the core of the problem is. But that is, you can point that to lack of preparation. But we believe that once the situation is upon us, how is it that we manage it better? This is not about preparation, anticipation. It's about how do we deal with a crisis? How do we respond to a situation? Ideally, we should have been proactive in managing it. Ideally, we should have been better in preparation and anticipation. But given that that did not happen, could we be doing things better at the management level? I think so. And where we are fundamentally going wrong, in my view, is the whole concept of management has not been decentralized. I don't think there's any structure that exists today in Bengaluru to decentralize. If there are issues that are being faced by people in a ward, the people who are best equipped to manage it are people in the ward through the ward committees and area sabhas. Today, that structure doesn't even exist. We look up to the government for passing guidelines, passing rules, and ensuring that it's all enforced. When it comes to execution has to be at the grassroots level. We can't expect the government and the government officials to execute. And more than anything else, the government should be realizing that. When we look at the central government, it's easy to say that the central government and the Prime Minister and the Council of Ministers failed, but they're going to manage 130 crore people. Similarly, at the state government level, we are managing 6 crore people. Even with the city of Bengaluru, 1.3 crore people, how are we going to manage all that? If we do not decentralize at the grassroots level for execution, whether it's a Swachh Bharat scheme, whether it is COVID management, whether it is delivery of Aadhaar benefits, I don't think the system is going to work efficiently. That's at a very, very fundamental level, a point that I wanted to put across since you asked me that question. Happy to hear your viewpoints as well on that.
No, I think what you have said is perfectly valid. And I also want to acknowledge what Katyayani Chamraj has said just now, that what disaster management cells were supposed to have been constituted as early as 2011. They were set up after Civic approached the High Court in 2020 April, but they seem to have disappeared again since nodal officers have taken the place of councillors. There is no general SOP for what disaster management cells. The draft SOP that Civic prepared and sent to Chief Secretary has not been notified. That's a point which she has said. I just wanted to evil it. But I'll come back to the point that Srikanth made. See, in the first wave, generally people were appreciative of the work done by BBMP, namely, they had created a number of COVID care centers, if you remember, including in the exhibition and other places. They had a war room in place. They had daily bulletins coming out. And there was a state of alert, that really, to my mind, was able to quell the flow of COVID to some extent. But then, events overtook BBMP because people began this migration into Bangalore again. And more than that, there was also a lot of inadequate COVID behavior, the kind of things people were doing, not wearing masks and not maintaining social distance and so on. And as Srikanth said, we were completely lulled into complacence about the second wave. Although I might tell you, Srikanth, dear friends, that the distinguished cardiologist, cardiovascular surgeon, Vivek Jowli sent a tweet in December. I'll send it to Srikanth if he after this, in which he cautioned people about the second wave, which he said was imminent. And he drew upon the examples of the Western European countries and the UK. But he was severely admonished by various people, including those in power, about spreading such dismal views, and he had to withdraw that tweet, not before there were many lakhs of hits on the tweet. Now he has brought it out again. So some intelligent people were aware that a second wave was in the offing, and now it has really overtaken us to such an extent, Srikanth, that I was a little delayed because I had to arrange through my good offices to get oxygen to one of the hospitals, a charity hospital with which I am associated in Jainagar. So, it's really at the brink, so to speak. And now what we must think about, my dear friends, is that of course there is infrastructure deficiency, COVID inappropriate behavior, improper centralization, etc. But what do we do now? That is the question. When people are lining up to the hospitals for entrance to the emergency room, there are not enough beds, there are not enough oxygen cylinders available. Question is, what do we do now? And that is what I would like to request all of us to discuss, because we'll put these ideas together and present them to Gaurav Gupta. But I would request Srikanth and the team to please now focus on Ramakant ji also on what is it that we should do today and leading for the next 1 month.
Okay, great,
Yes.
sir.
Yes. Go ahead.
Interestingly, couple of points I wanted to set as a context before we start opening it out. In fact, I think Mr. Jairaj has done something very interesting and fundamental for the benefit of all the participants. And I think that it's wonderful. Instead of what you're saying is, instead of people asking questions to you and you answering, why don't we evolve a collaborative approach by getting ideas from people, is what you're saying.
Correct.
Because the situation is new to all of us. Of course, we did go through this previous year. We have some learnings, but can we collect some ideas and can we present them? Before that, I want to set a couple of contexts before people start asking questions. One, the way we are doing it in apartment complexes. Today, as you all know, I'm the founder of Bangalore Apartments Federation.
Yes.
Today, that federation has almost 1,000 apartment complexes. As Mr. Jairaj said, what we do through the federation is release regular bulletins for people, right? Whenever there is a confusion, just keep communicating with people, right? What are the latest guidelines? What are the issues to be taken into account, etc. Now, if there is an organized set of RWAs, not just for apartment complexes, even for, let's say, individual houses in layouts where we can create RWAs, dissemination of information can be so very effective and efficient. So one of the things that we need to look at is, how do we create formal structures in various areas by constituting simple structures along the lines of an apartment complex automatically as an association. But can individual houses also align, and can we have representatives who can be representing those households? It could be 200, 300, 400 households then they take care of that particular community. Today in apartment communities, the way it's being efficiently managed is there is a managing committee comprising, let's say, 3, 4, 5 people who become the COVID task force, and they're regularly on top of things and they keep guiding the rest of the community. Can we extend this concept to individual houses and everywhere? If we organize ourselves like this, it becomes a lot easier. Even as of today, one of our colleagues came back. He said, I live in an individual house. What can I do in an area? I said, can you actually reach out to people in your area and can you all come together so that there is coordination that's happening with one or a few people? So that's one context that I want to set, where whether it's dissemination of information or taking corrective action, or purely in terms of coordinating with BBMP officials to run camps, vaccination camps, testing camps, becomes a lot easier. So that's one concept I wanted to put out to the members to see, is this an idea that resonates with people? Should we as citizens be organizing ourselves along those lines, and will it make things more efficient? So that's context number one that I wanted to set. Context number two is in terms of specific actions that we can do. Today, the key activities that are happening as part of, let's say, COVID management are the following, primarily, I would say, among many other things. Number one, vaccination camps. Number two, testing camps. I think there's not adequate testing that's happening, and people are becoming complacent, saying that we are not affected and hence they are infecting more people. So that's number two. Number three, availability of beds. And as Mr. Jairaj said, today, can we think a little bit more out of the box and come up with solutions along with BBMP, including setting up COVID care centers in PGs, hotels, service departments, etc. So availability of beds, not just through hospitals, but going beyond that. Number four, availability of medicines, whether it is remdesivir, which seems to be in short supply, or even the flu medicines like Fabiflu and the others that we are seeing. Is there something that we can do on that front? Number four. And number five, oxygen supply. I think that seems to be a big issue today. Oxygen supply, oxygen concentrators, where do we get this from? And in this also, is there some sharing of resources that we can do? If there is an oxygen concentrator available in an apartment, how do we make that available to, let's say, in the neighboring areas, a house that is in need, another apartment that is in need? So if we can have inputs coming from people, if we can have questions coming from people along these lines in terms of what we can do, broadly, we could think of these 5 things: vaccination camps, testing camps, beds availability, medicine availability, oxygen availability, right?
Excellent.
These are the 5 things that we were thinking.
I want to add, Srikanth, 1 or 2 points to what
Sure,
you
sir.
said, so
Sure.
that we can throw it open and ask Ramakant and others to jump in.
Yeah.
One is, Srikanth, there is a lot of scare all over, okay? Terrific scare today. Even among intelligent people, they think, the end is at sight. Everybody is going to be badly affected. And one of the things, Srikanth, is when is hospitalization necessary? A leading doctor in one of the major hospitals told me that hospitalization must only be in not more than 10% of the cases. In 90% of the cases, people can be at home and take care of these vital signs like, oxygenation rate, temperature, pulse, and so on. And only when that gets to be a little beyond the threshold is hospitalization warranted. The question, as you rightly said, is how do we disseminate that information? Because, sorry, Srikanth, I must tell you this, there's a lot of scare generated by the media also.
Yeah.
Especially your electronic media. I mean, you watch it, it's very difficult to come out of it with your senses intact.
I've stopped reading and watching.
I would like to ask our BNP colleagues, Srikanth, Ramakantji, etc., what do we do about a sense of responsibility for all sections of the people? Because there's no magic wand. For instance, everybody is saying there's a shortage of remdesivir. There is. But listen, I heard a very prominent physician say, Mr. Ramakant, the remdesivir is not a magic bullet. It doesn't do much. There are other things that are available which are as good as remdesivir. I don't know what the reality is, but I would like authoritative sources organized information to give me the correct picture. But you're right about oxygen. I was speaking to Praxair today, Srikanth, who are the major producers of oxygen. 400 tons of oxygen have been brought to Bangalore and distributed. And according to them, there's enough oxygen now. I don't know what is the reality, because the truth is otherwise. People say there's a terrific shortage. So I'm saying that, we require a very good, competent dissemination of information. And I would like BNP to take the initiative on this and see how it has to be done. I also like very much what you have said about vaccination camps. I think you should decentralize these vaccination camps, and you should have it as many places as possible if you have availability of vaccines now. And I also liked your point about testing camps, because I think people, if the testing is a little painless, the results are available quickly, vulnerable sections can get tested without difficulty. So these are areas, where we can expand our capacity without much difficulty, provided there is a will. Because many of the points that have been raised in the chat, Srikanth, is there's terrific centralization. What is the point at which we decentralize? How do we make things happen on the ground? What do we do in order to really now have a cogent presence to meet the situation? So I will throw it open now to colleagues for their comments.
Thank you. Thank you so much, sir. We'll now open it out for questions, or more than questions, as Mr. Jairaj said. Any suggestions?
Discussion.
Discussion. We request people to keep it brief. Already we have some 27 question Q&A in the Q&A window. We see some 12 hands that have gone up as well. So we'll have to keep it short. I'm just going to request first Salahuddin Muhammad. I'm seeing who has raised his hand. Salahuddin, you want to ask a question or provide a suggestion? Please keep it brief. Okay. So,
there are questions in chat, Srikanth. Why don't you read them also?
We can. Okay.
Salahuddin is there. After that, you can read.
Yeah. So Suresh Pai says, what record citizens of Bangalore will have if basic infrastructure like water, sanitation, road and garbage maintenance totally neglected? For over a decade, there's absolutely no governance. So Suresh, we have already discussed these in the previous sessions. This session, we're having a little bit more of an emphasis on COVID. So we'll focus on that. Milind has said, can we discuss at the end what BNP can contribute to the respective war to fight COVID? Yeah, once we finish this meeting and the discussion, we'll put up a summary and we can share it with all our group members. Thanks for that suggestion. G. Prasad says, thanks for the session. Wanted to know the teamwork between BBMP, Health Department, State Health Ministry, Public. Is there a coordination system? We need a daily work update at a point or dashboard. Very, very interesting and important point that Prasad has raised. Is there a coordination system and can we have a daily work update? So we do have our own views on this as BNP, sir, but Mr. Jairaj, you want to take note of that? You have any viewpoints on that or you want to respond to that?
Would it be advisable if we go through the questions and then I respond, or you want me to do individually?
We can do it individually and we'll keep collating the notes from this and then ultimately we'll summarize.
No, I think it's a great idea of Prasad that there should be a daily work update, and I like the idea of the dashboard also. But isn't it what BBMP is doing to some extent, Srikanth, that they have this COVID war room that has again started and they are trying to, give the availability of beds and they're trying to say what are the discharges per day, etc. It may be imperfect, the information may have to improve, but at least, I think where some acknowledgement is due, we must say that yes, BBMP has started on the right line. And I think there is a joint commissioner or special commissioner in charge of the control room.
Yeah.
And, I think, I would advise strongly BNP led by Srikanth to have a dialogue with them.
Yeah.
With him. And,
sure, sir.
Most of these guys are quite objective and reasonable. And if you are, also in a kind of constructive mood, you will find that they will also respond. So I would strongly request you, Srikanth, to please focus on what kind of coordination is there at the city level, because there is also, we read about a committee consisting of various people who are advising the government on it, and we have the health minister who's making all these statements. So I suppose there is some notional coordination, although I'm not in the government to know exactly what it is. And there is a disaster management committee headed by the chief secretary. In fact, the curfew orders, etc., are all signed by him. If you've seen it, I'm sure you've seen it. So yes, there is a nucleus of a body, but it must really be strengthened.
Yeah. So here is one more point
This
of view.
daily work update and dashboard, Srikanth, I would request you to kindly put it in your plan of action.
Absolutely. We have noted it down. There are two parts to this that I wanted to also respond on that front, and including what we are now beginning to do at BNP level as well.
Right.
So one is coordination between health department, BBMP, that's beyond our scope of influence, right? That's something that the government has to look at, but I think there is some work going on. We keep getting these notifications, etc. But the two things that are very significantly missing right now is last year, there were regular interactions that were happening between BBMP and RWS. If not on a daily basis, at least once every 3-4 days, regular interactions, etc. Right now, I think we are missing that. In fact, the situation is a lot more dire than it was the previous year. So the first thing that we need from BBMP and from Mr. Gaurav Gupta directly is to have, if possible, a daily interaction with RWS. Taking inputs, taking stock of the situation, collating inputs, possibly even create a dashboard at BBMP level to collate inputs from citizens on what's happening, so that they get a pulse of what's really happening, number one. Number two, as we discussed earlier, today the bigger problem that we are seeing is that decentralization is a huge problem. So in some of the wards, so one is, for example, I talked about Bengaluru Apartment Federation is doing a fabulous job in just disseminating information to apartment complexes and also managing testing camps and so on. But now if we were to start extending it at the ward level, in fact, an initiative that we have started at BNP is to now have regular interactions with the ward nodal officer, health inspector, and the doctor of the PHC. To start with, we are saying at least on a weekly basis, but possibly the frequency has to increase to, if not a daily basis, at least once every 2-3 days. So that the real problems being faced by the citizens on the ground can at least be taken off. The bigger issue is there of whether it can be solved or not, but that coordination needs to be there. So from that perspective, I think Prasad's suggestion is brilliant. It's a wonderful suggestion. We already are, in fact, today, as it stands, BNP has already issued a press release and has also conveyed that to BBMP, asking for ward committee meetings to happen more regularly where citizens can participate with their inputs. So that's something that
I intervene for a minute, Srikanth?
Sure, sir.
There is one excellent point made by Dr. Hema Divakar to all panelists. He says, where will people go and ask as to when they should get admitted? This is the point I made about hospitalization, Srikanth. This guidance should be clear from a large network of healthcare providers and volunteers whose capacity can be built on a digital platform to guide and reassure them that they don't need admission. Here is where BNP can play a signal role on this, Srikanth, to get a digital platform to really, with the help of BBMP, to advise people on impending hospitalization or staying at home and so on and so forth.
Yeah, no, absolutely. As I said, there needs to be an online form or online mechanism by which people can log in their issues, which BBMP can collect ward-wise as well and disseminate at the ward level. So thanks, Prasad, for that suggestion. Salahuddin, you wanted to go? You have unmuted yourself now.
Yes. Thank you very much for initiating a very useful discussion today. I'm basically, a planner, a plan executor, a project management professional, apart from being an energy professional. So what I see is your project is taken up or a problem is taken up on the initiative of the BBMP or whoever is the management of that particular group. They do not look into the aspect of what is it the people want really? What's the problem with the people? What is it that they're facing? What's the challenge for the people? because they are intended to be supporting the people, right? So before taking the initiative or suggestion or proposal from the people, they take up whatever they like to do. And I don't know what's the purpose or objective of their programs, That's why now we got a lot of complaining channels. We got complaints like BBMP Sahay, BESCOM complaint channel and things like that. I think more than that is a proposal channel. What is it that you want to propose? What is it where you want to improve? Because you want to go forward, not look at backs and then try to make a correction for whatever mistake has happened. So if we go into the preventive mode of execution of any project, then the problems will be reduced. There won't be complaints.
Reality, Salahuddin, is that the issue is upon us. Now the question is, how are we going to manage it? So we are happy to hear views from others also on what is it that we can do. As Mr. Jairaj rightly said, it's upon us. The infrastructure is not available. The issues are there in front of us. How do we manage? So we'd be happy to hear suggestions from others also, like the wonderful suggestion that Prasad gave. When we go to the next person, we have Gopal Krishna. Gopal, you can unmute yourself and you can share your suggestion.
Hi, Srikanth, and hi, sir. Sir, the people are getting, they are tested positive, or some people are getting tested negative. But so many people, they say that they have never tested itself. Some of the agencies who have taken it, they are not really doing it what they are supposed to do it. They're randomly sending people, okay, you're positive, you're negative. And if one positive person is there, they're just branding the entire family as you're positive. And it's creating a chaos in the families itself. Like it happened to one of my friends where that person he is positive just because he has to go to the market and he has a shop in the market. And yes, but the thing is, after getting the report, if it is positive or negative, it's becoming like, we don't know like exactly what the report is, what they have it is correct or not. How to rectify whether the report what they have received is correct or
not? Mr. Jairaj?
Yes, sir.
Yeah, issue of reports being right or wrong, I'm not sure what's it that we can do. Any thoughts, Mr. Jairaj, from your side?
Now, let me just think about it, Srikanth. Let me
it. Sure. But Gopal.
One suggestion, Srikanth, that came, I thought I'll place it before you. You said that the apartment federations, they're doing a good job. I agree with you. Why don't you have a kind of a daycare center for COVID in some of these apartment complexes, Srikanth, so that, you can relieve this burden on infrastructure. Of course, it has to be well thought about. You have to have SOPs, you have to have a proper approach. But do you think it's worth considering?
So I think these discussions have been going on in, let's say, making clubhouses of a few apartments as COVID care centers.
Right.
But the problem with that is it's a lot more complicated. In fact, we tried this even as of last year in a few large apartment complexes. But what we have to understand is that there is a full associated bed infrastructure, support infrastructure, availability of nurses, doctors,
personnel.
So, it was talked about in detail, but I think it's not as easy. I think converting, let's say, a PG or a hotel or a service department is a lot easier because at least the infrastructure is available in terms of beds at least and some basic service provisioning. In apartments, we don't have that at all, and hence that becomes a challenge. But one more thing with regard to what Gopal said, Gopal, that issue of positive versus negative, it's beyond the realm of what we can do right now. Yes, we hope that the system becomes better, but there's heavy load right now on that system as well. So I don't think we'll be able to address that right now. Let's move on to the next question. Katyani Chamraj talks about what disaster management cells. Mr. Jairaj, you also alluded to it. What disaster management cells? It's still not too late because we personally we believe that the situation is going to go from bad to worse. So probably as BNP, should we be pushing for a few citizens, at least about 10 to 15 citizens from the ward, to be part of a ward disaster management cell to be constituted by BBMP, and this team of citizens along with BBMP officials working along with BBMP to at least take care of the ward level problems? Is that a good idea as per what you would think?
How will it work in practice, Srikanth? Can we have a little discussion on that?
probably Katyayani herself is there. I think we'll probably allow her to talk. And
Sure.
Katyayani, you want to share your perspective on WDMCs?
Yeah, good evening, Srikanth. Good evening, Mr. Jairaj.
Hi, Katyayani.
Yeah, hi. Yeah, this is part of the rules itself. So I don't know why it has been disbanded. I think after the councillor's term got over, and the nodal officers, I think, have not been updated about this institutional structure. And in fact, Mr. Atik, like I pointed out on the question box, he even set up a area-based booth level committee with volunteers from that area, and based on the concept of area sabha. So, and in fact, Mr. Manjunath Prasad actually told that he would write to the UD and ask that every polling booth area will be declared as a as an area sabha, and so that that would get kind of a legal mandate also. But I think UD has not bothered to declare the area sabhas at all in Bengaluru, and I think that is a first step. They should declare every polling booth area as an area sabha and get the volunteers to work there in coordination with this ward disaster management cell. And the constitution of the ward disaster management cell was also prescribed in the circular that was issued after Civic went to the court. And the health department official, revenue, medical officer, everybody is part of that ward disaster management cell. And those need to be revived, I think, so that there is coordinated action at the ward level. And also it's very necessary as part of that, that's tried to set up a ward level helpline, because those centralized helplines, you could not get through at all very often, or they would put you on a hold for hours together. So it is very necessary to decentralize the helpline so that it is a manageable number of people you are going to deal with. And the ward helpline can, even manage the who needs hospitalization, who doesn't need, and who needs oxygen, and all those kind of problems could be solved at the ward level if these institutional structures are brought into action, I think.
I think the ward level helpline is a wonderful idea, and WDMCs with citizens being involved from the ward is definitely a great idea. I think this is something that we will take it up with BBMP, and Mr. Jairaj's help on that would be extremely welcome. For all of you who do not know,
idea, Katyayani. I think she's made a very valid point, Srikanth. I have a worry, Srikanth. I want to share that with all of you. All these are very valid, practical suggestions, undeniably. But the question is, and I want to pose it before all of you, does BBMP have the administrative capacity to implement it?
Mm-hmm.
I'm not talking of individual competence of, chief commissioner or zonal commissioner. I'm not on that point at all. I'm on the issue as to whether there is the requisite internal capacity on the part of BBMP to pick up a suggestion which BNP gives, for instance, on this point that was just made by Katyayani, or the points made earlier by Srikanth and Prasad and others, and bring it into practice. When are we going to look at that aspect also? Because
we would look to your good officers, sir. For people who don't know, Mr. Gaurav Gupta used to report into Mr. Jairaj when Mr. Jairaj
I'm not saying Gaurav Gupta will do it if, I'm saying they don't have the wherewithal to do it. I hope you understand my point, Srikanth.
We understand that, sir, but that's where what we are saying is, for example, as of 2.5 weeks back, when we had a ward committee meeting in our ward, CV Raman Nagar, one of the first discussions that we had with the nodal officer, in fact, the nodal officer was there, the AE was there, the health inspector was there, the doctor was there. One of the first things that we offered to them was we as citizens. There were about 25 of us who attended the ward committee meeting. And in fact, the first thing that we took up beyond the agenda was COVID. And we said, here are a bunch of 20 of us. We know that the administrative capacity of BBMP is extremely limited if not non-existent.
Correct.
Given that context, we said, why do you, there is a very simple way of creating that capacity, which actually should have been done earlier by formulating the ward committees and area sabha. But given that they were not done, here we as citizens, we are offering ourselves as volunteers, as people who can support BBMP and its officials in managing this. And this is the point that we want to put forth to BBMP. Why don't you take the help of citizens who
Exactly.
can act as quasi-officers, quasi-officials who are representing respective areas or communities?
I will go a step ahead, Srikanth. I will say, under your leadership with Ramakant and Soumya and others, why don't you create a citizen volunteer group, or whatever that's called, or call it by whatever name, and say that, we are willing to do it. That's a point that several of the people in the chat have made as to the fact that internal capacity of BMP, Bangalore Mahanagar Palike, cannot be developed on their own. They need partnership with citizen volunteers from different sectors. I would request you to please to note this as a point of action on your part.
Absolutely, sir.
May I
Naman,
just add one point?
Yeah, just before that, Mrs. Katyayani, I want Mr. Ramakant to just actually quickly step in here.
Yeah.
They have, not just, I was talking about my ward, Mr. Ramakant's ward also, they have created a Citizen Connect group. They've been very closely, they've created a group which is available for BBMP. Mr. Ramakant, a quick 1 minute on
Really,
the
sir.
group that you have created.
Yeah. ನಮ್ಮಲ್ಲಿ ನಂದು ಹೇಳೋದೇನಂದ್ರೆ BBMP ಡೈರೆಕ್ಷನ್ಸ್ ಕೊಡುತ್ತೋ ಇಲ್ವೋ ಸಿಟಿಜನ್ಸ್ ಮಾಡಕ್ ರೆಡಿ ಆಗ್ಬೇಕು. ಸಿಟಿಜನ್ಸ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ತಗೋಬೇಕು. ಇದರಲ್ಲಿ ಏನಿದೆ ಅಂದ್ರೆ ಮುಖ್ಯವಾಗಿ ನಮ್ಮ HSR ಲೇಔಟ್ ಅಲ್ಲಿ ನಾವೇ ಒಂದು ಸಿಟಿಜನ್ ಗ್ರೂಪ್ ಮಾಡಿ, ಡಾಕ್ಟರ್ಸ್ ಪ್ಯಾನಲ್ ಮಾಡಿ, ಅದು ಡಿಸ್ಕಷನ್ ಮಾಡಿ, ಜನರಿಗೆ ಮುಟ್ಟಂಗೆ ನಾವು ಆಗ್ಲೇ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬಿಟ್ಟಿದೀವಿ. ನೀವೇನ್ ಮಾಡ್ಬೇಕು ಅಂತ ಮಾಡಿದ್ಯೋ ಆಗ್ಲೇ ವಿ ಆರ್ ಒನ್ ಸ್ಟೆಪ್ ಅಹೆಡ್ ವಿತ್ ದಿಸ್. Committee has been formed, doctors have been coming. We have invited all the HSR doctors. We have made a panel of doctors. We're discussing in the apartment wise, what are that has to be done, what has not to be done. All the discussions are taking place. We are already one step ahead in the HSR activity, sir. ಜನರು ಮಾಡಲಿಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಗಬೇಕು, ಜನರಿಂದನೇ ಇದು ಮುಕ್ತಾಯ ಆಗಬೇಕು ಹೊರತು ಗೌರ್ಮೆಂಟ್ ಹೇಳಿದ್ರೆ ಮುಕ್ತಾಯ ಆಗುತ್ತಂತ ನಾನು ಒಪ್ಪ.
Fantastic. Can I make a request to Srikanth? At my request and behest, we have a very distinguished physician here attending this meeting, Dr. Hema Divakar. Srikanth?
Yeah.
Can we request? She was the president of the Federation of Obstetrics and Gynecologists for India. She's an all India figure. Can I request her on your behalf to say a few words on, hospitalization and the need for doing it briefly, Srikanth?
Absolutely. In fact, I've allowed Dr. Hema Divakar to talk. In fact, Dr. G.V. Divakar and Dr. Hema Divakar, they are very active supporters of BNP, and I'm glad that they are here.
Yes.
Dr. Hema Divakar, over to you on your thoughts.
Yeah, thank you, Jairaj. Thank you, Srikanth.
No problem.
There are several points that I have been making on the chat, and I'm glad that they have been looked at in the correct perspective. And as I said, connect and collaborate should be the philosophy, because it's everybody's responsibility, but the efforts have to be channelized in the correct direction with correct advice from people like Sri Jairaj and Katyayani and others in the team. So whatever blueprint has been done in the HSR by Ramakant ji and others, we should not reinvent the wheel. If that has worked there, let's quickly replicate this in the other wards as well, because we have something to lean on. And the kind of doctor panel, the residents panel, everybody is just running helter-skelter, but please remember, everybody wants to do something. So we'll encash on that positivity in everyone, that they should do their bit and be contributory. So we need to draw lessons from the blueprint, and really there should be a set of good communicators. That's all we need, but it has to be in multiple languages, because English very few people know, Kannada, Tamil, Telugu, whatever, because people need to understand in their own language what needs to be done next. I'm sorry to say that even all across the healthcare providers also, they also are not very sure of what advice needs to be given next. Multiple, opinions are taken, and finally it lands into a confusion. So there is a lot we can do. simple things, but those should be the initial big steps. So vaccinations also, Divakar's hospital is a center for vaccination, but every day we are turning back the patients because the stocks are getting over within 2 to 3 hours. We have very limited stocks available to us on a daily basis. And if this can be enhanced, we can ourselves in each of the wards create those in the apartment complexes and in the community areas, in schools, where people can come and queue up for vaccinations. And we are quite willing to have the volunteers work 24/7, because a massive role of vaccination that can play with more than 60-70% of the citizens covered will go a long way in breaking this chain, because gone are the days where we can compel people to wear the masks and do the social distancing. It just happens in spurts, as you have seen, and it is not a consistent thing that is going to be. So mass vaccination is the way forward. And of course, the 10% of the cases which will need correct guidance as to where and when they should get admitted. With these, I think with these 3-4 points, if we solidify and move forward, I think instead of discussing 20 other points, we focus on these actionable, low-hanging fruits and move ahead. Thank you so much for the opportunity.
Thanks, Dr. Hema. Yeah. In fact, many of these suggestions, I would, in fact, just bring to the notice of people that the current Chief Commissioner of BBMP, Mr. Gaurav Gupta, used to work with Mr. Jairaj when he was the commissioner and he was holding various positions. So, Mr. Jairaj, all these inputs that we are collecting, we definitely do want to take it to Mr. Gaurav Gupta. And if we can take your support as well.
I'll arrange a meeting for you with Gaurav Gupta.
Absolutely.
I don't know how much time he has, how harassed he is, but he's a very, I mean, as you know, Srikanth, he's a very pragmatic person. He wants to do good things for the city.
Yeah.
I don't know whether he has the breathing time for that, but definitely I'll do my best to help you people.
That'd be great.
But as Hema said rightly, sir, please boil down a few, the core recommendations, and let's take it forward, Srikanth.
Yeah, sure. Which is what we are, as we speak, we are collecting all the inputs, sir. So we'll summarize all of this and we'll present it to our group as well. Yeah. Sir, with your permission, can I also request Mr. Nagaraj Rao,
yes,
who is the president of Bengaluru Apartments Federation,
of course,
just to quickly talk about what we're doing in apartment complexes, both in terms of communication and also in terms of these vaccination and testing camps that Dr. Hema Divakar also just alluded to. Mr. Nagaraj Rao, over to you, sir.
Yeah, thank you, Srikanth. Good evening, Mr. Jairaj.
Hello, sir. How are you?
Very fine. Thank you very much.
Nice to see. Put on the video. Let me see your handsome face, sir.
I'm not getting the...
Srikanth.
Yeah, I have to promote him to panelist, which
Nagaraj Rao has worked with me. He's a wonderful person. He was in the sericulture department, extremely capable, hardworking, and a conscientious officer. I remember him with great affection and regard.
And Mr. Nagaraj Rao, a youngster, all of 83 years old, extremely good friend of mine. Together we built BAF. So.
Wonderful. And he's a tennis player of distinction.
Oh. Yeah.
Very handsome guy.
Still remain handsome. Over to you, sir.
Thank you, Srikanth and Jairaj, for the superlatives. I don't know whether I'm eligible for all the superlatives. Anyway, Mr. Srikanth has built up the BAF, and then we are trying to continue that along. Now, I am restricting myself with the apartments in Bengaluru, which are member apartments in Bengaluru, which are about 1,000 in number now. It was about 300 when Mr. Srikanth left. Because of the virtue of Srikanth's influence and the work that we turned out, we could make it as 1,000 now.
Wow.
In fact, Mr. Jairaj made a mention about my field of silk. I had some similar experience of the pandemic in silk also. Wow. And I was made the champion by the minister to control this. Had it not been controlled, we would have finished the way the sericulture department, silk would have vanished from Karnataka like France. Anyway, coming back to this, with that experience, I'm telling that there are two things very major important in controlling the pandemic. I'm coming straight away to the pandemic. One is, of course, the self-discipline, which is on our concern, self-discipline. I mean, whatever you call it, COVID management protocol, whatever it is. Second is the man management. It is not the COVID that is going to create problem. It is the man management. As Mr. Jairaj rightly put it, the capability of the organization to control this. I don't want to use the word control, because both these can happen with a proper communication. As Mr. Srikanth put it, there has to be a communication. We did have a couple of meetings with the commissioner, special commissioner, as well as the earlier commissioner to do it. And Mr. Vikram and the team have been working night and day to get the communication throughout. We have been regularly releasing bulletins. We must have released already a 7th or 8th bulletin by now, based on the guidelines issued by the government of Karnataka and government of India and the BBMP. In fact, we have tied up with the BBMP in this particular regard of COVID. We have identified zonal leaders from the apartment federation to be in coordination with the zonal commissioners, and they have been. And we had about 4 of the zonal commissioners had a meeting, and we called most of the apartments in that particular area how to do it, because most of the people in the apartments believe that it should come from the horse's mouth. Though we have been issuing communications periodically, we thought that a meeting with the head of the particular zone is better. That has been done. And you were telling about the individual apartments. What we have now gone is, we have created a positivity group. Wherever the apartment gets a positive case, immediately they log into that and become a member of that group, so that they get all the advice required for controlling that. That positivity group has a volunteer from each apartment. Either it could be the president or any other representative, who will be communicated, who will be the communication between the BIF and the apartment. We can't communicate directly with all the 1,000. So we have a slight hierarchy of the zonal leaders to coordinate with the higher ups and the cluster presidents. Cluster here, I mean, it is not the cluster that BBMP does. They have hijacked our word of cluster, but this is a positive cluster of development. So the cluster is nothing but an apartment community of the constituency. We call it cluster. President and secretary are the persons who handle that. So I'm just giving a brief about the hierarchy. And this communication is going from the zonal. Every day, the WhatsApp messages are flooded with question and answers. And then we have been trying to communicate both the BBMP directive as well as our bulletin.
Very good.
Yeah.
We have organized already.
Sir, Mr. Rao, we'll need others. There are lots of people are waiting to talk.
Okay,
So,
I'll finish in one or 2 minutes.
If we can quickly wrap up. Even we wanted to summarize one key, takeaway from how we have been doing it with apartments to a larger ward or RWA level. But broadly speaking, I think, sir, the 2 main aspects, and I think which is what we alluded to at the beginning of the call also. Communication is key, right? And if you're able to create ward level communication, if you were to extrapolate what has been happening in Bangalore Apartments Federation to, let's say, what we need to do at a ward level, if the ward officials can create a ward level group comprising citizens from different communities, it could be an RWA, it could be an apartment, or it could be even a slum for that matter, getting representatives from there, having them in a group, communicating with them so that they in turn can communicate to 100, 200, 300 people. I think that's the most efficient way of communication. Otherwise, communication is all very dispersed and diverse. It becomes very, very difficult to manage. The second takeaway from what Mr. Nagaraj Rao said and from the BAF experience is, if we are to succeed in this battle, we have to ensure that we create a simple structure where things are managed at the local level. if you're able to create some kind of a hierarchy where you have a set of people at the ward level, which could be the ward disaster management cell, then you break the ward down into areas. From each area, you have a few representatives and one person representing that. And from each apartment and layout, if you have one person who's there to manage their respective areas, then the problem is totally decentralized and we are creating that administrative capacity also that we just talked about. I think those would be the two key takeaways from what BAF is doing and what we would like to replicate in BNP from that experience at the ward level as well. So I just wanted to summarize that, sir, so that now we can get on to others. So Jairaj, anything from?
I want to ask Nagaraj Rao one short question. I know there are many people who want to. Mr. Nagaraj Rao, I heard what you said with great interest. Also what Srikanth started. I want to know, Nagaraj Rao, very briefly, what is the impact of all these measures? Can you tell us in 1 or 2 sentences?
Yeah, we are tried. The two things are the positivity rate, which would have gone up in the normal course. We are monitoring each apartment's positivity rate, the technology that is being used, and Vikram and Arun have done the wonderful thing. And every minute gets updated so that we have an idea of whether the positivity rate is going up or not. Now, for information, some of the areas it is going up, but on most of the cases, it is at par in the sense there are no new cases of positivity, just because that people are having some sort of a self-discipline which has been brought up, and we have told them first, you discipline yourself before disciplining COVID. That has been the case, and hopefully we will be in a position to put it across. Though we do not want to have too many COVID centers in the apartments, which Srikanth has explained. I don't want to expand it, but we want to identify the positive persons by organizing camps in the apartments. And in my own apartment, this is the 4th camp we had today, 4th camp, and there were about 5 positive cases, and we have taken note of and then what is to be done there. Well, whether it is, we have tied up with the hospitals, with the BBMP, both, and the volunteers will call them, or the hospitals or the BBMP will call them. Some of the BBMP have been very efficient. Bomanhalli, Yelahanka, and Madhepura, they are very efficient. They do call, and we have that system of the Google Sheet, which is going to them also, because on the request of Mr. The Chief Commissioner, we had a meeting with him, and then we have created this. So we have been following it up. But the only thing is, the question is, why are you forcing us to get the testing done? In some of the cases, I personally,
Mr. Rao, yeah, I think that issue, Mr. Rao, that issue, I think we'll have to take it up separately, right? On testing camps. We'll really run short of time now because we're already at 7:20.
Thank you.
I think I have finished whatever I wanted to say.
Great, sir. Thank you so much.
Can we have some more lady representatives, Srikanth? Most of us have dominated our males. I would request you to allow some of your lady members to please speak briefly.
Yeah. By the way, before that, only one thing I would request is, there are lots of comments that have come in the chat and the Q&A.
Yes.
Requesting one of the panelists, either Soumya or Lalita, to copy all of that and note it down so that we can compile and consolidate all of that, and then we can share it in our group so that it becomes a summary of what we need to be doing.
Absolutely.
And the assurance that we are giving to the team is all the suggestions will be considered, and we will plan on a follow-on meeting again with the Chief Commissioner of BBMP, Mr. Gaurav Gupta, with the assistance of Mr. Jairaj, and we will present some of these things. And even today, we've been having discussions with people where we will reach out to all of you so that we can start implementing some of these things at our respective bodies. Yes,
there are some fantastic suggestions, Srikanth, from Mr. Praful Babu to all panelists. Anybody requiring plasma for COVID treatment, please contact. There is given a list of some 30 people to contact. I think he must be a member of your group, Mr. Praful Babu. So things like that, Srikanth, there's so much of potential in volunteer groups, we have to tap it, Srikanth. I request you to please do it. It's fantastic.
Sure. Yeah, absolutely. We'll probably, quite a few people have raised their hands, are not, We'll probably just go to the next person. I can see Ravikiran Kasi. Ravikiran, you want to go next? Ravikiran, you're unmuted. You can give your suggestion, or you can offer your inputs.
Yeah, see, I'm talking on behalf of Ravi Kiran. I'm his wife.
Can't hear
We are
you.
from Jainagar 7 block. We have been doing a lot of charity work and drives around our area. Last year, we did a lot of free ration, and throughout the year, we've been doing a lot of footwear distribution, as we are also part of an initiation called Soul Warriors. Now, my son is in 10th, and we have been wanting to do a small internship activity for him, where we want to do a free vaccination drive in our area, so that we can cover up a little of the backward classes, because we do have a little of backward classes around our area. So, but we are not able to get a right connect with any of the BBMP officers or some medical persons who can who can even guide us in the right direction. So any BBMP doctors or whom we can contact to, who might be able to help to come over and do a vaccination drive here.
Yeah. By the way, do you know which ward is yours?
It is Karisandra ward.
Karisandra. Yeah. Okay. That's, I think, Ward 166. So
Yeah.
we'll probably get the team to connect up separately on that.
Okay.
But sir, I think one interesting point that she has brought about, internship for students to do vaccination drives. I found that quite
Then,
interesting.
Srikanth, these vaccination drives, they're governed by strict protocol and all that. What she might have meant is to help the weaker sections get onto the vaccination drive.
That is one thing. Awareness campaign is one thing that we do want to do. Go around talking to people to encourage them to get vaccinated. But we are also trying to connect with a medical officer who can arrange for free vaccinations, and in coordination with the local corporator here, Mr. Lakshmikant, who is Yashoda Lakshmikant, who is the corporator here, to arrange for the place and the facilities that might be needed for the vaccination drive. But we need somebody who can bring over the vaccines, and with the nurses or doctors, whatever is needed. So we want to connect and see, what is needed, so that we can connect with the doctor and then the corporator of this area, and see what all needs to be arranged for the vaccination. But we do want to do a free vaccination drive around our locality.
That's eminently possible. We are already helping organize that in quite a few areas. So I'm sure it should be possible to be done in your ward as well. And I think that's something that we would want to take up as a general practice, where vaccination camps we want to do in conjunction with the BBMP officials. Of course, when we do it with BBMP, it's a free vaccination camp. But then, having said that, we can do it in conjunction with private hospitals, in apartment complexes and all. People would be happy to even pay that vaccination fee. So that should not be a problem. So we should definitely connect up separately.
Okay, all right. Thank you.
Sir, we actually have only 5 more minutes left. So we'll be running short of time. So Mr. Jairaj, we can even sort of spend a little bit more time, if possible, going through that. We also want to remind people that we have the last session of Belief coming up tomorrow at 6 p.m. Request all of you to join through that same link, bit.ly BNP Belief. We have Mrs. Renuka Ramnath joining us tomorrow. She's one of the leaders in India who has created a great corporate setup. She was one of the core team members from ICICI, who created the great institution called ICICI Bank. And she went on to create a large organization of her own, one of the biggest coming from India in the Indian financial systems industry. She's going to be addressing us on how do we overcome odds. We middle class people, how can we overcome the odds and the things that we are doing? How do we develop the belief and the self-confidence to achieve these things? How do we build teams? How do we build an organization? Is something that she's going to be talking about tomorrow. She comes with a wealth of experience. She has created now an organization which manages billions of dollars of assets. So people like Mr. Jairaj, Mrs. Renuka Ramnath, these are all people. Mr. Jairaj, of course, comes from the public life. She comes from a corporate life, but all of them have the same thing in common: build great organizations, enduring value and values, build great teams. The learnings from all of that for us in terms of how we can go about doing that. So please don't miss the session tomorrow as well. So we'll get back to the questions. So should we just take one more from the Q&A window, sir?
Yes, sir, please.
I'm just seeing which is the most relevant question. Gautam has something which says, suggest government to give guidelines to RWS and other institutions who wish to set up COVID care centers. Also, how government will support such initiatives. Sir, we already discussed this. COVID care centers and apartments, it's been tried in quite a few places. It's not an easy proposition at all. Instead, we the citizens can work along with the ward officials to identify hotels where we can provide support to set them up as COVID care centers. Setting up hotels as COVID care centers is a lot easier proposition than setting it up in an apartment complex. The two big differences between hotels and apartment complexes: hotels have some basic infrastructure available in terms of hotel beds, food availability, etc., which is not there in apartment complexes. Second, hotels have a service setup also available in terms of staff being available for providing services, support, not necessarily nursing support, but housekeeping support in terms of other service support that they can provide, which is not available in apartment complexes. So inherently, COVID care centers, we believe, are that is, hotels and service departments and PGs are probably a little bit more amenable to being set up as COVID care centers. And that's something, for example, in my own ward, right next to my apartment complex, there is actually a hotel, Mercure Grand Suites. We are trying to, there are almost about 50 to 60 rooms that are available. There's a proposal that's going on to convert that as a COVID care centers. We at least create a 60-bed COVID care center immediately. And that's something that we are looking to work with government officials. Mr. Jairaj, anything that you want to add to that?
No, I don't want to, but I'm just seeing something very interesting that has come. Srikanth, can I just tell you what it is? Srikanth?
Please, sir, please.
It is a message from my former assistant in the government called Asif, and he has given a list of all the numbers you can contact if you want any information on COVID, and people available between 8 to 11 p.m. morning, afternoon, evening, etc. And also what kind of information you can solicit from them. Can I just pass it on to you, Srikanth, and you can please look at it?
Absolutely,
and if you think it advisable, you can circulate it. No, I'll send it to you and to Ramakant. You can have a look at it. Huh?
Absolutely. Thank you so much for that.
Yeah.
Purva Dhut has another suggestion, or probably a query. When vaccination opens for all from May 1st, it is going to be chaotic. How do we ensure that it happens smoothly? Of course, she's talking of it opens for people above the age of 18, all the adults. How do we ensure that it happens smoothly with social distancing and other COVID protocols? Would be helpful to have camps like being held now in apartments.
That's a very good question, Srikanth. In fact, I saw it. I wanted to say that BNP should do a separate brainstorming before the first on how this vaccination for people above 18 can be successful, and what are the pitfalls, and what can you do by way of volunteering to help the public authority to ensure smooth the smooth execution of this program.
Yeah. Yes. And we totally agree with Purva. Once it opens on May 1st, already we are seeing that in PHCs, in government hospitals, as well as in private hospitals, there are a lot of people who land up, and it creates problems of social distancing, COVID protocols, etc. And we believe that, again, decentralization is probably the key here. If we are able to get BBMP to run camps in apartment complexes, or even in layouts where we find an open space where we can get it done, we can actually get the managing committees of the RWS and apartment complexes to set up proper time, coordinate with their respective residents on timing. And if you stick to those timings, then people come one by one without having to crowd or queue up in the same place. So we can actually conduct vaccination camps very smoothly and efficiently, following social distancing protocols and COVID appropriate behavior, and still get a lot of people vaccinated in a reasonable span of time. So I think that definitely is a great thing, as you rightly said, so sir, as well.
Yeah.
I think we will definitely promote more of that to happen in various.
Srikanth, in this correction, I want to add, as rightly told that above 18, in HSR layout, we already decided a different program. What we have decided is morning session and evening session. We have decided for morning session will be above 18, afternoon session will be for above 45. This particular program we have planned. Accordingly, we want to go ahead with the just suggestion. What you have, because there should be halagulla, because a lot of people start rushing into inside, and there should not be confusion. This plan, what you have made, just I am suggesting to the entire team. Sir, ಇನ್ನೊಂದು ಮಾತು.
Sir, Ramakant sir, now just a few more people. Any discussion that you want to do with Mr. Jairaj, we can do it separately.
Okay.
We have unmuted Ajit Lakshmi Ratan. Ajit, you want to go next?
Yeah. Good evening to all of you. I've been listening to some of the great insights given by Mr. Jairaj and so many others who are there speaking. I live in Whitefield, and I'm very glad to inform that Whitefield Rising has formed a group, and which they have been sharing a lot of information as to the availability of beds and ICUs and things like that. But at the same time, we have a lot of groups where information which are outdated are being circulated. For example, that the ICU beds are available here, and that oxygen available at this rate at a particular place. Remdesivir is available here. Unverified, unvalidated information is also floating on a number of WhatsApp groups, and leading to a lot of confusion and people rushing here and there and searching for beds. I'm very happy to inform that Whitefield Rising in one particular group has allocated some persons. They've given them the responsibility of identifying the verify the source, whether it is correct or not. And even the rumors have been set right. And I think they have done a great job. And I think similarly, like many of you here, I also listened to Katyayani Madam and Mr. Dr. Hema Devakar also come out with some good ideas. And I think we can follow it in all groups. And how to debunk some old posts which continue to be in circulation. Srikanth, I think that also should be done.
Excellent point, Ajit. Srikanth, before we conclude, I want you to discuss a little more about this mass vaccination drive from 1st May, Srikanth, because we just have some comments which says 100 vaccinations per hospital or per clinic is not going to provide a lot of coverage. We need to ramp it up massively. What are your thoughts? What are the thoughts of all our other colleagues on this is a question I'd like to pose before you.
No easy answers.
It's very critical because, you know, vaccination is the only way you can reduce this
complications.
Sure. So before that, just to add on to what Ajit said, one suggestion, I think Ajit made a very important point.
Yeah.
Today, there is so much of unverified information. Now, unverified information on guidelines and all is fine, but contacts of people floating around saying that he can provide oxygen or medicines, I think it creates a lot of confusion. I was wondering, can we take it up with BBMP to have one central information repository which they update, and that becomes the de facto information repository, whether it is contacts for oxygen providers, medicine providers, or even beds availability, which people access, as we talked about war rooms and we talked about information dissemination. If you can have one central portal or an app, in fact, it could be just a portal which people can access on their mobile, it makes life a lot easier. Everybody just refers that link to people to say, please go and check this. Is that something that BBMP can do, and what does it take to get it done with your experiences?
Wonderful.
Absolutely. It is
Excellent.
possible. Sorry, Ajit, go ahead. You were saying something.
No, sir, I concluded. But I think some of the insights what all of you have given have been extremely very, very important.
I think the
And in the
central repository is a great idea.
Great
We
idea.
already discussed that, Srikanth, in the first half of our discussion.
Yeah.
When we said this daily work update, dashboard, and this daily interaction with RWAs. As part of that, you can please bring this up also.
Absolutely. So we discussed the protocols, and I think what Ajit was talking of is also contacts of the
Absolutely.
various
Absolutely.
service providers, etc. Yeah.
Absolutely.
Anybody wants to go on Mr. Jairaj's point? How do we do mass vaccination, which is the need of the hour? And
One
we
or two
totally agree.
ideas that we can pass on.
Yeah.
Jairaj, this is Lalita here.
Hello, Lalita. How are you?
Good evening, sir. Hegidira.
Nice to see your profile.
Yeah, thank you, sir.
Video
Sir,
on
Nandu-
Lalita avare, ಹೇಳಿ.
Yeah. My question, my point to that is, I think we have 18 to 45 is a very, very long range. I think between 18 to 20, we need to create buckets of ages, probably do it 3 days in every ward areas. All this needs to be planned. BBMP has to call for volunteers to come and help them with all the due protocols that needs to be there, but it has to be bucketed. As per me, one thing is with age bucket between 18 to 20, then 20 to probably 25, something like that. If we do,
Very difficult to manage that, Lalita. Now bucket ಗಳು create ಮಾಡಿ ಈ ಏಜ್ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಬರಬೇಕು, ನೀವು ಬಂದ್ರೆ ಚೆಕ್ ಮಾಡ್ತೀವಿ, ಅದು ಬೇಡ Lalita ಅವರೇ. Let us do it on a mass scale. Yeah, forget about age groups. I mean,
then BBMP has to call for volunteers because
Exactly.
they need people. They need people. Otherwise, because PHCs are overflowing now.
One thing I have found, Srikanth, if the government or public body tries to regulate, the regulation falls on its face.
Yeah.
We don't have the capacity to do it. Although Lalita made a good suggestion, Nan helodu, what are the suggestions of BNP for making sure that this mass vaccination from 1st May does not become another flop with mass crowds everywhere and stampede and, pushing around. It is horrendous to imagine that, Srikanth.
Yes, sir. And I think we already discussed this as well. If the vaccination drive, when it opens up for people above 18 from May 1st, has to be a success, we firmly believe that the mountain has to go to Muhammad and not the other way around. BBMP has to interact with citizens and go to where they are and run camps area by area. And possibly, obviously, and this is not to say that we close down the PHCs or anything of that sort. People are still open to go there. But we have to create a schedule. In each ward, we create a schedule of areas. Area by area, we target, probably identify some of the slightly higher risk areas, the slightly more dense kind of residential locality, target those first, and then keep going on.
Can I make a suggestion, Srikanth?
Sure.
Because we are already running out of time. It is 7:40. Can I make a humble suggestion?
Yes, sir. Absolutely.
Between now and 30th, you organize another brainstorming. I will join if you want. And you please only discuss this, how to help public authority organize a proper mass vaccination drive from 1st May.
Yeah.
Yenantira Ramakant avare?
Yes, sir. Correct, sir.
And we can have all our colleagues join, like Lalita, and I'll ask Hema to come. Tau, you can please call others, and let's, if you can prepare a small blueprint, Srikanth, we can discuss it and get it going.
Wonderful.
Suggestion most welcome, sir. We'll probably do one more session specifically for this.
Yes.
In fact, Anjali has also commented on I think Anjali Saini, Whitefield Rising, they've also been doing a wonderful job in their area. I think she says most people will wait for the camp to come close to them if the area is published in advance. And I think that's going to be key. If we have to do this successfully, we have to identify areas, publish it in advance saying that it's going to happen in this area. That way we just go step by step and do this. Probably should we just request Anjali to...
Okay.
Yeah.
Added to that, I think still the government has not issued the guidelines on even the cost, etc. Right? How this has to be classified for the underprivileged class and the other needy, this one, that is also something that is still pending.
But I think if it's BBMP who's going to do it, it'll be free of cost, Lalita. Why we have to just discuss that with private hospitals.
Not sure. Okay.
Yeah, sorry. Anjali has a. Anjali, do you want to share? Is it Anjali Saini or is it different Anjali?
Anjali Saini, yeah, that's right.
Yes, Anjali.
I think it's a very good session and very timely. And in Whitefield Rising, we just had this discussion today, and we thought that, we were trying to figure out what's the best way to help. And I think they had come up with, having a COVID care facility and helping with oxygen. These are the two areas we had identified. But I think you brought up two very good points. And I had a question for Mr. Jairaj, what he had brought up, which is, talking about whether you need to be hospitalized. Do we have any numbers on, how many of the hospitalizations are not really required? I mean, is that something that we should really be focusing on?
Exactly. I mean, all these are anecdotal, ma'am. All are anecdotal, but I have heard doctors say that majority of the hospitalizations are not required.
Really, majority?
Majority, but I have no firm data. But
that's definitely something that should be looked into.
Yeah.
Because it could be that, because if you look at the recovery rate is more than 98, 99% for people who are sick.
Exactly.
The question becomes, why are the hospitals getting so overwhelmed?
Because of scare, Anjali.
That's right.
Because of scare.
Scare, right.
Because everybody and his brother want to rush to the hospital. Srikanth, I was talking to the CEO of Ramaya. Anjali, this is of information to you.
Yes.
In the 1st of March, there were only 40 COVID beds. Today, there are 800 COVID beds. I mean, that's the kind of ramping up hospitals have also done. We can't blame them and say that, you don't have any beds, etc. And, they have other issues which I don't want to go into, like, getting payment from the government, all that.
Yes. Of course, corruption is always the key in the middle of all this.
So this is a very timely discussion. Yeah. I really want to thank you from the bottom of my heart, because I met so many spirited individuals like Ramakant and Lalitika. Of course, it's amazing. And, if you can tap their energies and their constructive talent, you can be the difference, man.
I think that's pretty much what we would like to do, sir.
I honestly feel that.
Yeah. So with the guidance and support, we had Dr. Hema Divakar, Anjali from Whitefield Rising, Jairaj Rao from Bangalore Apartment.
Jairaj Rao, 83 years old.
Right. And then, so there are different people from different aspects of governance. Katyayani Chamaraj, of course, and of course, sir, your guidance as well. I think we can tap into all of this. We need to have ideas which are, I think, coming through. We need to know what does it take from an administrative setup perspective to make it work. How can we citizens collaborate is another thing that we have to understand. Yeah. Now we are at 7:45. There are still quite a few people who have been posing queries, questions, who have raised their hand. It's impossible now to take all of that into account. I think, Mr. Jairaj, shall we plan on a session during the middle of the week?
Yes.
We'll consolidate all of this.
Yes.
Probably around 7:30, 8 o'clock, we'll plan in the evening. Yeah. Or we could even do it, let's say around 6 o'clock in the evening, Tuesday or Wednesday. Yeah. We'll consolidate all of this and probably again call for people to come in and, if possible, get queries a little bit in advance with which we can consolidate them.
Right. Internally, Srikanth, I think BNP and you should do a brainstorming among yourself as to how you can help in the vaccination effort from 1st May. Please do that yourselves.
We are already doing that. We are already helping out in a few wards where we are working along with BNP to set up vaccination camps.
And
but
folks,
at a larger
I want
level,
to make a request to Srikanth and to Ramakant, Lalita, all of you. Please give a helping hand to BBMP. Because, I worked there, I've been there, I've seen how it works. They are in a very, very difficult position. And I was just seeing the list of officers. They're trying their best to reach out. They may not succeed, but I think with your active assistance and cooperation, you can make it a good partnership. I request Srikanth to please spearhead this partnership.
Sure, absolutely, sir. And that's very much. And the whole essence of this session was that. And what we told people right at the beginning is this is not about politicizing or playing a blame game here.
Yeah.
This is about how we can extend a helping hand, a supporting hand for BBMP to manage the situation.
Absolutely.
The numbers that we are talking, I don't want to scare people any further, but can we control things a lot better so that from the current 3.5 lakhs per day, can we bring it back to zero in the minimal time that we can do it in? I think that should be our single most objective in all our minds. And that's what we need to be doing for the next few months. So we are committed to it. So I would like to take this opportunity to thank all of you who joined this. We'll do a follow-on session on this, specifically again on COVID management and how BBMP works and how we can work along with BBMP to do this.
Absolutely.
In the meantime, sir, Mr. Jairaj, we'll connect up with you separately to see how we can take up these points and again have an interaction with the Chief Commissioner to take these inputs provided to him. We'll take more inputs. We have Krishna Rastogi, Robert Clive, Venkata Satya, Gangadhar, Bhargav, Sunil Narayan, Parvati, Kumar, Stella. So many of you who have raised your hands. We are sorry we cannot, take this any further today. We'll update you on the next session that we are going to do. Why don't we all come on board again? We'll take these questions and suggestions and inputs again. Let's consolidate and let's make this. Sir, and thank you so much, Mr. Jairaj. Instead of making it a Q&A, yes, Mr. Ramakant, instead of making it a Q&A, he actually made it interactive and engaging, which I loved personally, Mr. Ramakant.
ನಮ್ಮ ಕಡೆಯಿಂದ ಧನ್ಯವಾದಗಳು. ನಿಮ್ಮ ಒಂದು ಅನುಭವವನ್ನು ತಿಳಿಸಿ ನಮ್ಮಲ್ಲೊಂದು ಹುರುಪು ಧೈರ್ಯವನ್ನು ತುಂಬಿದ್ದೀರಾ ನೀವು ನಮ್ಗೆ ಇವೆಲ್ಲ ಹೇಳಿದ್ದಕ್ಕೆ. ನಮ್ಮ ಆರೋಗ್ಯ ನಮ್ಮ ಜವಾಬ್ದಾರಿ. ನಾವೆಲ್ಲರೂ ಸೇರಿ ಇದನ್ನು ಚೈನ್ ಮುರಿಯೋಣ. ನಾವು ಈ ಸರಿ ಇದನ್ನಷ್ಟೇ ಮಾತಾಡಿದ್ವಿ ಜಯರಾಜ್ ಸರ್. ಮುಂದೆ ಇದಕ್ಕೂ ವರ್ಸ್ಟ್ ಆದ್ರೆ ಮುಂದೆ ಏನ್ ಪ್ಲಾನ್ ಮಾಡ್ಬೇಕು ಅದನ್ನ ಕೂಡ ಡಿಸ್ಕಷನ್ ಮಾಡ್ಬೇಕು ನಾವು. ಇದನ್ನು ಕೂಡ ಒಂದು ಆಫ್ ದ ಅಜೆಂಡಾ ಇಟ್ಕೊಂಡು ನೆಕ್ಸ್ಟ್ ಮೀಟಿಂಗ್ ನಲ್ಲಿ ಸರಿಯಾಗಿ ಮಾಡಿ ಎಲ್ಲರನ್ನು ಸೇರಿ ನಾವು ಇದನ್ನ ಚೈನ್ ಅನ್ನು ಮುರಿಯೋಣ. ಬಹಳ ಧನ್ಯವಾದಗಳು.
Meanwhile, stay safe. And be safe. Namaskara.
Thank you all. And again, a reminder for everybody, tomorrow 6 o'clock, we have the session with Mrs. Renuka Ramnath on the power of belief. We need a lot of belief to tide through the situation. So let's look at the power of belief tomorrow. Let's get as much motivation and as much inspiration from people who have delivered tasks that were considered impossible. Look forward to seeing you all tomorrow and look forward to a follow-on session with Mr. Jairaj a little later. Thank you all. Have a good week ahead.
Namaskar.
Before ending, let's have the belief to be more positive by mind and not COVID positive. Let's be strong. I think the fear is causing the half the problem. Let's all remain stronger. Thank you.
Thank you all. Bye.
Thank you. Thank you.
By the way, Lalita or Soumya, have you been able to copy the transcript of the Q&A in the chats?
I had logged on from my mobile.
So Soumya?
Yes, we've saved the chat.
Okay, both the Q&A and the chat. Soumya, both the Q&A and the chat, right?
Yeah.
Okay, great, Soumya. Thanks so much. Thanks all. Bye.
Thank you. Thank you, Srikanth.